Hello YouTube, welcome back to my channel. Today I'm just going to be doing a what's in my clinical bag video. So I just finished organizing it some so that I can be able to maneuver through it, because honestly it doesn't stay that organized because I throw stuff in and out of it all throughout the day most of the time. So yeah, let's get into it. So first, what I do, like a personalized thing, is I have a binder, just a little small one, half an inch, and it literally has so much stuff in it, like my clinical schedule, my clinical syllabus is in here. I got blank sheets of whatever paperwork we might have, different things to like different breakdowns and different stuff that they give us for our actual clinical paperwork, like cardiovascular assessment breakdown, neural breakdown, musculoskeletal, like all of that stuff. I just have different, like, let me show you one. Can you focus it? That's just a blank one. I just have that. And let's see. Oh, here's the neural one. It's just different paperwork in there. Just so many things. Got the we have a packet that has the NANDA approved nursing diagnosis for 2018 to 2020. I printed that out and added it in here also. Got some blanks, patho sheets, because we have patho sheets that we do that are due before clinical and everything. So I got those put in there. And nursing care plan paperwork, because sometimes I like to do them while I'm at clinical. Assessment sheets, different. I just have a lot of different paperwork. Some of it is just from previous semesters, because they'll change like the layout, so you'll have to use whatever layout you have for that semester. But I put some of the old ones in there just in case, like, I want it, maybe I might find it useful, and then I already had printed it from previous semesters, so if I can use it at some point in time, I just want it to be in there in case I want to use it. I have body maps for concept maps. We drew on those mostly our first and second semester. Just some blank paper. Then I have a section that has like all the completed work that I might have, all clinical work that was completed, my ICU prep worksheet, my work packet that I had to do, which was like kind of thick. We had to do like 5 medication sheets, 5 patho sheets, and then answer some questions on them. And then the hospital that I'm at, they had a abbreviations and symbols packet that they put up for us like last semester or sometime ago, and I had printed that out a while ago and still had it, so I added it in here to be able to use it. And then I had some quick guides that I had bought a while ago, and I just, that one and this one in here, and I just added those in there. So yes, this is important. I just keep this with me in there. Then I have some books that we use, and nursing diagnosis book, medical surgical nursing that goes, it's the clinical companion that goes with our book, and then the drug guide that we're using. Keep that with me in case I gotta look up a medication, so I won't be on the computer too much. You know, I can just write down the medications that the patient is on. Then if I don't know it, I can just go into my drug book instead of being on the computer, because our teachers don't really like us to be on the computer too long, and the nurses, they don't want students to just be sitting at the computer all day long. Like, even if you're trying to, you know, if it's important and you want to look that medication up, it's just, you know, doctors got to use those computers, CNAs, the LVNs, like everybody has to share those computers. So if you're in the way, then it just causes more problems. So yeah, I keep this with me in case I need to look up medications. I showed you guys before my clipboard, the nursing edition. So yeah, keep that with me. I just bought a new blood pressure cuff, which I didn't think about it before. I had bought a blood pressure set that had pediatrics, adult, and then like obese, like adults and stuff like that. And it had the different blood pressure sizes and stuff. But I bought a new one because the last one had this part broke, and I didn't think to just buy just another one of these or whatever. So yeah, so I have a whole new blood pressure cuff, but the good thing about it is these can pull off. I can pull these off and add them to my other blood pressure cuffs in case, which this came in handy because I had to do manual blood pressures on a patient, which they also have the ones mounted on the wall, but it just depends on what you want to use. So I keep this in there just in case I need to use it. My stethoscope. Yep. Have that one. It's just a little basic, the basic kind of Littmann. And then we get into, I wear my little scissors on me. I have that. And then I have my pen lights. They're both, well, is this one Prestige? Well, this one's Prestige. Doesn't really matter name, but yeah, I just have two little pen lights. Yeah, I have pen lights, my scissors. I keep some pens in here. I have this little thing right here also that I got this like when I was like, you know how you get excited for nursing school and you're just like, oh yeah, I'm just gonna buy this and buy that or whatever. So I bought this little thing and I don't really even like carry it on me like you can, like as a little thing, so you can actually try to, you know, carry it on you, but I haven't really carried it on me. But it does come with the two scissors and a pen. So yeah, I just keep that in there. Little notepad in case I need to write something down real quick and I don't have my clipboard, or it's easier just to have this sometimes. So I used this for a long time before I got like into using clipboards, because I don't like to carry. Before I got the foldable clipboard, I didn't like carrying my clipboard because it's just like in the way. You're like, you don't want to really set it on a patient's bed because it can get like all these germs and stuff all over it. You don't want to just set like I just don't like sitting my stuff all in patient's room and stuff like that all over the place, because you never know, like so, and you can't really just sanitize the clipboard like every time you go in and out of the patient's room. So I like the foldable one better. But before I got my foldable clipboard, I just had the little different little pads and stuff just to write different notes, and I kept the extra ones in here. It gets cold, I get the runny nose, so I keep these little tissues, some type of tissue in my bag. And then I keep some lotion. And I'll just refill this back up with whatever lotion. This isn't even cocoa butter. I just fill up whatever lotion I have so I can have some type of lotion on me. Again, I told y'all I had gotten a thermometer for Christmas, basically, from my aunt, and the pulse ox. So I keep these in there also. I don't really use them at clinical. Everybody in my family's been getting sick lately, so that's what we've been using them for, basically, taking everybody's temperature and stuff. My cousin had gotten a fever, so I was monitoring her temperature and stuff like that. But you know, they have their own vital sign machines, but in case it is like taken and you need an emergency one, I have this just in case. And you know, at the hospital they also have manual ones on hand in case of emergency and stuff like that. And then I just keep some ibuprofen. There's some regular just ibuprofen in my bag in case my cramps are like bad, or I just don't feel good and I just need something. Because I don't like missing clinical, especially this early in a semester when we only have 3 absences. I'm not clinical, we only have 2 absences this semester. So the last thing I want to do is be missing clinical really early, because you never know when you're going to have an emergency or anything. So yeah, so I keep those on me. I do not like to take any kind of medications, especially like ibuprofen, and I don't know. I just don't like to take any medicines if I don't have to. This recently is I haven't used medications like for my cramping and stuff like that in a long time. I did use one this last time recently, but because it was just bad and I was in clinical and I just needed medication. So yeah, but I try to avoid having to take medications because of the damages that it can cause to your stomach and your liver and kidneys and stuff like that in the long run when you take it too much. So I only take it when I absolutely need it. But yeah, so that is basically my clinical bag. That's like everything that I carry in my clinical bag. And I mean, I know some people don't even carry that much stuff. Like that's just like the mostest. Like, and as you can see, I have a big clinical bag. So I'm gonna show y'all everything. So, oh yeah, I got a calculator in here. That's probably from like some dosage cal. I don't know. I have a calculator in here also. But you see, I have okay, so we have this slot right here. We got 1. Then we got 2. Then this opens up and it has a little pocket right here. Okay. It has 1 right here, 1 right here, and another 1 right here. So it is very spacious. It has a lot of space, and I know this would be more useful like when I become an RN, because and within this pocket, like, it has like a little clip, a little like when cell phones were like Nokias and stuff, it got one of those little cell phone spots. But you know, ain't no iPhone sitting in there. But yeah, so you have that, and so after you have those 3 areas, you have 1 on this side, 1 on either side. So yeah, then another 1 over here, and then inside, look how spacious. Look at that. It's huge. It is. So you got that, and then you have another little pocket right there inside of that big pocket. So you don't have to worry about space with these bags. I'm definitely going to be using this for a while if I do when I do become a nurse, because it has the these little straps also, so you can put them together. You can carry it like that, or you can carry it with this strap. And you see the little cute print? It's like so cute. Like, I got this when I first was getting into nursing school. So it's so cute. So yeah, that's about it. That's everything that I have in my clinical bag. That's everything I take besides, you know, my badge. I hang my badge up in my car. So when I get ready to go to clinical, I could just grab it, put it on, and be good to go. So, and my headphones. I bring my headphones because I listen to music or whatever during my lunch break or whatever or in the mornings if I get there really early. But yeah, that's everything that goes in my clinical bag. I want to thank you guys for watching. Subscribe, like, comment. I hope you enjoyed the video. Let me know if you like it. And please come back and watch again. Thank you.